Hi gymnastics family, my name is Dr. Hailey and today I'm going to be talking about elbow and knee dislocations, which is not a fun time. However, they are something that happen when falls do not go as planned, and sometimes it could happen in your gym. So I'm going to be talking about what we can do to help that athlete after a dislocation. As a coach, I have seen in the gym an athlete fall with their hands stretched out in front of them. This is something that I am constantly yelling at gymnasts about, is to learn how to tuck and roll, and we've even done drills in the gym to tuck and roll. However, it is our instinct to protect our head. So when a gymnast falls, sometimes they reach out. Unfortunately, what could happen is a patient could dislocate their elbow at that time by reaching out in front of them. And I've seen it happen before when I've been run across the gym and find that this athlete's elbow is dislocated. One of the biggest things I can tell you as a healthcare provider, do not try to relocate the elbow. I've seen coaches try to do this and I've had to stop them. There is a vast amount of blood supply and nerves to the distal part of your hand and your arm. And if you try to put the elbow back in, it could cause blood supply loss. One of the biggest things you can do is keep the athlete calm. Keep them laying down and just give them a sense of security. Keep their arms still and don't try to move anything or relocate anything. Then call 911, call the child's parents, and have the paramedics come out. If there is a lack of blood supply, then the fire department needs to get the athlete to the hospital immediately so that they can relocate the elbow and prevent them from having blood supply or nerve damage down to their hand. If there is a good amount of blood supply, everything seems fine, just the elbow is dislocated, what you can do is the parents can drive the athlete to the hospital at that time. I'm hoping this never happens. However, it's really good to know that you should not relocate it as a coach or as a parent. Just leave the elbow alone and get them help from the fire department and then to the hospital. In regards to knee dislocation, so a lot of times when somebody dislocates their knee, it's really the kneecap or the patella that shifts out of place. This should be relocated also by a healthcare professional. However, if the gymnast ends up straightening their knee, sometimes the patella will go back into place. So if a gymnast fell, hurt their knee, and said, it didn't feel right, it popped, it clicked, maybe something shifted around, it could have dislocated and then relocated when they extended their knee again and straightened it out. This is not a medical emergency if the patella gets back in line. However, it is something that at that point you would want to go follow up with your primary care doctor, see a physical therapist or an athletic trainer for rehabilitation just to maintain that stability in the knee again, or possibly if it was bad enough, they might have surgery. At this point, it's just important to know that an elbow dislocation is a medical emergency. A knee dislocation is not as emergent. If you have any questions or comments, please do so below. And I hope this never happens to any of your gymnasts because it is not fun. However, if it happens, we want to make sure we're taking the right steps to keep the gymnast safe. Thank you so much for watching. Go ahead and give this a thumbs up because you learned something new, and subscribe so you can learn more tips and tricks about keeping your athletes and gymnasts very safe. Remember, we are teaching gymnasts that they are strong, powerful, and limitless. Thank you.